So currently, we see a system that probably is approaching $4 trillion in terms of spend on healthcare. And as you mentioned, about 20% of GDP focused on the healthcare sector. As you look forward, given your perspectives on the industry, what are a few of the opportunities and challenges you see in the future?
So I mentioned this, question of, access earlier, which can be a highly political topic, right? From the, Medicare for all debate to, total privatization. But I think it's from a technology and a clinical point of view, it's an important topic as well, because we have all this fragmentation of data in healthcare, which constrains some of the innovation. And some of the innovation that's happening is around defragmenting, standardizing that data, so that many of us access care across multiple doctors' practices and facilities, maybe even states, and it makes it very hard for clinicians to have the data they need and to make the best decisions. So that at some point comes back to how do we ensure that everybody in the U.S. has access to the care they need? And then how do we ensure that their clinicians have access to the data they need? And for those uninsured or underinsured individuals, that aspect is just that much harder. So I think that's going to continue to be an issue going forward in healthcare. And then the second piece of that, many of our students were very young when the Affordable Care Act initially came to be under President Obama. But part of that premise was around something we call value-based care. So the concept of paying for value, paying for outcomes. What if the hospital or the doctor got paid by how well they treated you, or how healthy you were, versus a very transactional system, getting paid to do things to patients. You get paid to do surgery, you get paid to see them. There's a real resurgence of that concept under the current administration, I think partially accelerated by COVID. And so I think that is going to be very interesting to see what happens there over the next 4 years.
And what do you think is key to achieving, that type of an advancement?
So it's been there. I think there are two things. One is policy. The sort of behavioral economics of healthcare is that health systems and organizations are going to continue to behave how they are incentivized to behave. And so to the degree that they are paid well to take care of sick patients, more than they are paid to ensure that patients are healthy, they're going to continue to do the first one. And so, we'll talk to health systems about, readmissions. Someone's in the hospital for a hip surgery, they get discharged, something goes wrong and they get readmitted to the hospital. If that hospital still makes money by taking care of that patient who gets readmitted to a larger degree than they do a penalty for that patient getting readmitted, then that's what drives their revenue in their business. So the policy around that is going to have to change. And I think is going to have to be more punitive or carry larger incentives to help people bridge, because they're sort of been stuck in the middle. When from sort of the ACA to today, there are a lot of systems that for one reason or another haven't been able to make the transition, and they're sort of stuck in this in-between space. The second, so we've got policy, and then I think the second piece is enablement. How do we provide them with the tools and technology to change the way that they practice, to be more proactive, more predictive in their models of care for a population of patients? Because now if you're going to get paid to keep that population healthy, you need the tools and technologies to help you know how to do that, right? And that's not something that sort of your average, administrator or doctor is trained on to understand, panel management, population health management, and it's certainly something they can't do without technology.
So if you could just talk a little bit more about the emerging side of technology and its application in the field. What are some of the things that you see coming, maybe here already, but more on the horizon?
Yeah. So everybody talks about artificial intelligence, and in healthcare and virtual reality and a lot of those different sort of buzzwords. And, I think of that as sort of the now, the near future, and the distant future. So there's some great examples of artificial intelligence, in diagnostics, of looking at the eye and images of the eye, and where the AI can be actually more accurate than, your average or better than average doctor at diagnosing certain conditions. Breast cancer imaging, right? So sort of that pattern recognition where you can train a system to be really accurate at recognizing abnormal patterns and flagging that drives efficiencies and drives down cost. So that's sort of where we are today. There's a lot of hype around AI that's like really far from where we are today in terms of, an AI system replacing a doctor in the assessment and diagnosis of a patient in sort of general medicine. And I think we're neither there in terms of the technology, the acceptance of that by physicians, the regulatory framework for that, and the consumer acceptance of that. And so it's going to have to be sort of a crawl, walk, run approach of, prove cases where today something like AI really makes sense. Think about what's next, and, what else in medicine has, complex patterns, complex data analysis that's really difficult for humans to do. It's time consuming or requires very advanced training, that AI might be a better fit. And then, looking towards the distant future, what is really the role of something like AI? Is it augmented intelligence? Is it meant to complement the human beings, not replace them? I think probably so.
So we talk about in many different career fields how the digital future is kind of playing out. And I just imagine, given Rimidi's focus and the market in general, the notion of remote patient monitoring and remote care provision, wearables obviously becoming a much more dominant thing just socially in the world. Where do you see that kind of heading for us in terms of the connectivity of individuals to the healthcare system on a perpetual, ongoing basis?
So again, I think something that was accelerated dramatically by the pandemic, because all of a sudden we had patients who weren't able to access the healthcare system where usually those testing and surrogate markers of disease were done. So we pushed that into the home, right? Both with wearables, with medical devices, with sensors in the home. And, I think that cat's sort of out of the bag, right? Of it's, a continuous data set, or a data set with 300 points, not 2, is always going to give you more information. The question today is, how do we use that information in clinical decision making? Because clinicians are overwhelmed with data. And their perception is not, oh, if only I had more data, I would be a better doctor, right? And so with all of those concepts, it's really the curated data set, the analytics around that, the impact and the action that we have to be building the technology to enable. There are people building amazing technologies, for getting away from even wearables to, sensors in your clothing, to the camera on your phone, being able to measure all your vitals. Like, all of that will come. And the key question is, so what, right? What are we going to do with that data that is actually going to improve the outcomes or make healthcare much more cost effective than it is today?
As you think about the future, if you could boil it down to, the what one thing, what one advancement, development, insight do you think will have the biggest impact on reaching some of the more favorable objectives for the healthcare system?
Maybe this concept of a unified medical record, because there's so much inefficiency and so much waste in our healthcare system. And if you compare us to other developed countries, if I circle all the way back to where I started at the beginning by mentioning spend versus life expectancy, most of those countries have a national medical record and a national payer system. And that affords them a much richer data set and insight, holistic insight into that individual's health. So politics aside around single payer and that debate, but if we could get to the ability to unify medical records at the individual consumer level, that would be incredibly impactful